Check me out. Check me out. Hey. Getting the party started for my YouTube fans. Oh no, I don't want to block that. Sound like, all right, let me jump on Instagram. And we going live. Hello. So what am I calling this? Let's see. Y'all know y'all gotta give me some time to get everything set up. Let's see. Okay. Welcome back. Welcome back. Welcome back. I am Professor Health. I am the mad scientist. I am your friendly neighborhood healer, but not your average dope dealer. Hello, hello, hello. What's up, bruh? So, waiting for some more people to come on and join in the room while I am getting the presentation ready for today. We're going to talk about some interesting content that I feel like everyone needs to know about, or they're asking questions, they don't know information. So the less ignorant, the better. We're going to talk about it today. So we are going to talk about HIPAA violations. Is it legal? Is it not legal? Are you violated? Is anyone in violation of your HIPAA rights? And the Vax. And for purposes on YouTube and social media, you guys know that I do not say the actual name. I'm not going to say things like that. I do not want to be flagged, and I do not want to have any type of issues or smoke. So, you know my terminology, so make sure that you're keeping up with it. So, let me go ahead and get this presentation popping. If you are on YouTube, as always, you will be able to see the presentation. If you're on IG, feel free to go back and watch the PowerPoint presentation that I'm discussing as you hear me on IG, but you don't see it. So let me tell a couple people that we in the building, as we always have to do. Let's see who pops in here today. Tell a couple of people. Tell somebody, tell somebody. And if you came in and you left, bring your little butt back on in here, because we got some things to talk about in class today, in chemistry class. So welcome, welcome, welcome. Welcome back. Welcome back. Welcome back to chemistry class. So when I put the shout out APB, I'm looking for people. I want you guys to check out these funky little, what are these called? I don't even know what they're called, pins or lapel pins. And they are just so super cool. Like this one, I think it says, who wants to be a princess when you can be a scientist? Okay. And then this one says science, bitch. So I was thinking of selling these on my website for young women or whoever would like to, you know what I'm saying, be a little science, be a scientist, be a big scientist when they grow up, be a big stepper like me. Hey, what's up? Okay, so we're gonna go ahead and get started. For whoever's not here, they're joining late, But for the people who are here, for the people who tuned in or tapped in, let's go ahead and get started, because I do not want to keep you guys forever. So today we're talking about the Vax and Hipaa violations. And what we all need to know in this world, our laws and regulations are changing because of this unprecedented pandemic. You gotta know what rights you have out here in the world. So let's get to it and let's do it. Start from the beginning. All right, the Vax and HIPAA violations, legal or illegal? If I have some participants in here, y'all know how I like to do my gold star members, my gold members. Like, we like to have class participation. So for those who are not in here, I need y'all to be up in here because y'all know Professor Health likes to ask questions. We like class participation. For those who may be in here, I don't know if you guys left, bring that ass right on back. Hey, Nisi. Okay, so we like participation in chemistry class. So what we're talking about today is the Vax and the HIPAA violations. Does anyone have any pressing questions before I go on to the presentation about HIPAA? Or does anyone have any questions about the Vax? Like how it relates to laws and employment or anything like that you would like to put forth in front of me before I start the conversation. I can at least make note to point out when I'm actually doing a presentation. Hello, Pretty C Noob. Thank you for joining us today. So if there are any questions, what up, Chrissy? So if there are any questions before I go on to the content, again, today chemistry class is about the Vax and the HIPAA violations, legal or illegal. We're going to touch on a lot of the content. Feel free to ask questions, and I will get to them as we go along, or I will get to them when we're finished. So, trending news. There's a lot of trending news out here, Instagram, social media, on the actual news stations. What's trending in the news all surrounding this Vax, right, or the vid? So, New York City. First U.S. city to require proof of the Vax for indoor dining, gyms, performances for a variety of New York City workers by September. What up, So Mayor Bill de Blasio putting pressure to wear down citizens into getting the Vax. So if you are located in New York City particularly, you may want to check out your state laws as they are changing, because there's going to be a lot of information. What up? There's going to be a lot of information that you're going to need to know so you can know how to navigate, how to maneuver through this unprecedented pandemic. Because a lot of people would like to, just by nature, just by nature, you want to protect yourself, you want to protect your family, you want to make the best health decision that's best for your family. And that's your choice, and you do not have to share that information with nobody but your family. However, you need to know in certain states, in certain districts, certain jurisdictions, what your rights are, so you can make sure they're not being violated, and you can make sure your ass don't go to jail or any other repercussions. Okay, so New York City, first U.S. city to require proof of the Vax for indoor dining, gyms, performances, and for a variety of New York City workers by September. And why? The mayor is putting pressure to wear down citizens into getting this Vax. Hey, Soro Omega. Hey, I ain't forgot about you. Okay. So France and Italy, not in our realm, but because of this pandemic, everything's kind of intertwining, interlocking, because like you said, it's unprecedented, right? So people are sharing public health information. They're trying to figure out, how can we tackle this globally? And I say tackle, quotation marks, okay? France and Italy issue mandates like this, the ones that just like New York City has mandated. So France and Italy did that last month. But what's been in the news this week, President Joe Biden, federal employees not mandating the Vax. Why? Federal government not a private employer? No, they're not, right? You're paid by tax dollars, right? Not a private employer. But by law, can't mandate. Yes or no? We're going to discuss that. Will require the vid testing to wear down employees into getting the Vax. So now President Joe Biden has come onto TV and the news, and he's saying that, listen, we want more people to get this Vax. Remember when he first became president, he got voted in. Within his first 100 days, he wanted to have like somewhere to 1 million or more people get the Vax, right? So now he's like, the numbers, I guess he's not very keen on. He's not appreciating those numbers, right? So he's like, we want more people to get the Vax. So now he's saying that federal employee, which I am, so this pertains to me, has a lot of relevance, We're going to make it so hard, basically, that you're going to want to get the vax. That's basically what New York City is also doing. We're going to wear you down. We're going to apply so much pressure that you're going to become isolated from the normalcy of life that you'll want to get it, right? That's what they're basically trying to do. So you're either going to get the vax, right? You have your little vaccination proof card, you have your vax card, right? Your medical card, and or if you do not, they're like, you're going to have to get tested. How often you're going to have to get tested, I'm pretty sure it's going to be cumbersome. It's going to be a headache. So, but that's the route I would choose, and that's the route I'm choosing. For me, I'm not here to tell you what to do with yourself, but I am here to provide you with the content so that you can make better decisions, right? With your health and for your family's health. Hey, Wadada, thank you for joining us. Okay, so New York City, mandates, vax mandates. They're going nuts with this, okay? France and Italy, same thing as New York City. Now, President Joe Biden is trying to crack down on federal employees. What you gonna do? I'll tell you something, I ain't getting the vax, okay? And now, DC, this is the kicker. I wanted to talk about this when it happened on Saturday, but I was a little too hot to handle to discuss this, so I had to do some more research. So, DC Mayor Muriel Bowser is sending volunteers to knock on doors of DC citizens, come into their house, will come onto their property, right? And ask if you've been vaxxed. Anyone in your family or in your household have been vaxxed. WTF, right? Is this a violation of your HIPAA rights? And for those who don't know what HIPAA is, we're going to get into what HIPAA is. But is it a violation of those rights? Because I was steaming. Someone came to my house, knocked on my door, asked me, had I received a vax? And, you know, I'm kind of taken aback because I'm not your average Joe. Like, what? Like, you don't talk to me like I don't know what's going on in the world. And not only that, I'm a freaking scientist. So I'm like, excuse me? Why are you coming to my house? Gave him so much attitude. Why are you coming to my house to ask me about my health status? Because that's none of your business for me to share. So then I'm clicking, my cylinders are clicking. First of all, can he even ask me that? Did he just violate my HIPAA rights, the HIPAA law? So I had to do some research, and that's what I'm here to tell y'all today. Not only in DC are they sending people around, you can best believe it's coming to a city, a town, or state near you. Also believe this was happening in New Jersey as well. But if it's happening in DC, you better believe it's going to be happening near you. So be ready. I don't answer the door for strangers regardless. I actually have my door open because I leave my door open because I'm the type of person I like to see what's going on in my neighborhood. I like to know what's going on. I hope I didn't lose y'all. But I like to know what's going on in the neighborhood. So I keep my door open, and I have a pit bull. So I'm not really terrified. And I got a lot of other things to keep people from coming up inside this house. But however, he asked, and then came back the next day and they asked if my neighbors had been vaxxed. Who the fuck, excuse my language, knows the health information of the people that they live next door to or they are surrounded by? That's their private health information, not for me to know. However, let's move on. So HIPAA, what's HIPAA? And if I timed out, I'm sorry, I had like a little connection issue, but bear with me. Okay, so if y'all still in here, give me a thumbs up, give me a like, share, subscribe on YouTube. Make sure that you guys are still here, you're still connected. Want to make sure I'm not just like going off the rail. Want to make sure you guys are getting this content. So we're going to get deeper into it, but I want to make sure that everyone is here. So give me some class participation, if you will. Let me get a hey, how y'all doing out there? Where you're from? Thank you, thank you, thank you, thank you, Stacy. Thank you, Nisi. Thank you so much. Okay. So HIPAA. What's HIPAA? The Health Insurance Portability and Accountability Act, established in 1996. Now it's maintained and enforced by the U.S. Department of Health and Human Services by the Office of Civil Rights. Now, if you have a complaint, if you feel like someone has violated your HIPAA rights, if you feel like an employer has violated your HIPAA rights, if you have an inquiry, if you want to get more detail about HIPAA and the vax and how it relates to this pandemic, I want you to write down this number because you can either call and complain or inquire. 1-800-368-1019. I'll go ahead and I'll pin that in here. This is the Office of Civil Rights. For U.S. Department of Health and Human Services. 1-800-368-1019. And I just pinned that. Excuse me. And I just pinned that. Okay. Now, the Office of Civil Rights, OCR, has provided guidance for HIPAA and the VID, but these guidelines aren't crystal clear. So there's a lot of legalese that's in these guidance and these policies that you may or may not understand. Is really some lawyer jargon, but for clearer comprehension, make sure that you call, ask questions, and if you have that long paper, you're a big stepper and you can hire an attorney if you feel like you're having an issue to work through, I would suggest that. But definitely don't be afraid to call and ask questions. It is your right to know what your right is, okay? Don't let anyone deny that. So discrimination protection, this is what you get under HIPAA. Discrimination protection and protects health information, privacy, and security. So your public health information, right? Your health information, your PHI, is for you and the consumption of you and your caretaker or your health provider, right? And there's other entities I will say that's covered under the HIPAA. We'll go over that. Outside of those entities, those people are covered under the HIPAA. They cannot violate HIPAA. Hello, Andrea. They cannot violate this. If they do violate that, trust me, take that to your attorney and you're going to be a wealthy person, okay? However, federal law is a federal law and it gives you rights over your health information, who can review and receive this information, whether it be orally or electronically. A continuation of HIPAA. Protected health information. So that's what your PHI is. Your health information is protected. And a part of your PHI, your protected health information, is whether or not someone has received the vax. That is your protected health information that you do not have to share. But there are caveats, and we're going to go over that. Now, the HIPAA privacy rule limits uses and disclosures of individuals' protected health information to use and disclosures required for treatment, payment, or healthcare options. Treatment, payment, or healthcare options, right? Now, other uses and disclosures generally require consent to be provided by an individual in writing. However, HIPAA only applies to certain organizations and businesses. So when we're talking about who can ask you certain things, who can receive this information, who can use this information, who can use your protected health information, certain organizations and businesses are covered under this HIPAA law. Who is under coverage of the HIPAA law? We'll discuss. But before then, your protected health information, like I said, is your vax information, whether you've received it, whether you have not received it, whether you don't want to disclose the information. That's your PHI. It's covered. But whether you have received it or not, covered under HIPAA, but only by covered entities. Those entities are your healthcare providers, your health plans, your healthcare clearinghouses. What is a healthcare clearinghouse? Public or private entity, including a billing service, a repricing company, community health management information system, and there are a host of others that you can Google or find on the Department of Health and Human Services website, and their business associates and or third-party entities, right? That's who's covered under HIPAA. If those entities violate your HIPAA rights by sharing any of your protected health information without your consent, when consent is required, that is a violation of your HIPAA rights, okay? Now, let's get into the questions that people really want to know. They want to know, how does this relate to me and what I got going on in my life? Can an employer, as the employer's healthcare provider, ask for proof of vax? Can an employer, as an employer's healthcare provider, for proof of vax. So if I am employed by Big Lots, can Big Lots ask Blue Cross Blue Shield for proof of my vax? Yes, they can. That's not a HIPAA violation. Employers have a duty of care under the Occupational Safety and Health Act, blah, 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 OSHA, to provide a safe workplace for employers. This will be the justification that is going to get thrown in your face. You have to know these things. When employer is asking or reaching out to your healthcare provider wanting to know any type of information about your protected health information when it pertains to the vax. Yes, they can ask, but your healthcare provider has to get written consent from you to provide it to your employer. If they do not get written consent to provide your protected health information to your employer, that is a HIPAA violation. We in the money, okay? Now, can someone ask if someone has gotten the vaccine? Someone came and knocked on my door. Can they come to my door, regardless of whatever entity it is, or whether it's just your neighbor, or whether it's someone you work with, or wherever you are? You go to the gas station and get some gas. The attendant wants to know, have you received the vax? Can someone ask you that? Yes, they can ask you that. That's not a HIPAA violation because they are not a covered entity under the HIPAA law. Remember, we talked about health plans, healthcare providers, healthcare clearinghouses, and their business associates. So someone can come up to you and ask you, and have you received or gotten a vax? Now, how you choose to answer is on you, but they can ask you, right? They can ask you that. It's not a HIPAA violation. However, it can possibly violate federal laws depending on who is asking you this information. Okay? So, can an organization ask an employee, customer, or relevant third party whether they have received the vax against the vid without violating HIPAA? So, can an organization ask an employee this? Can an organization ask a customer this? Yes, they can. They can ask you that, and it's not a violation of your HIPAA rights. So if you're highly reactive like me, when someone asks you about your protected health information or something you may think ain't none of your damn business, whether or not, and you may be wondering if you're aware of HIPAA, you may be wondering, did you just violate my HIPAA rights? No, they did not, sis. No, they did not, bruh. Now, these laws have been changing because of this precedented pandemic. Okay, so as of December 2020, even in May 2021, these laws have been changing and they're ever changing. That's why I say know the state laws of where you're at in your jurisdiction because they are changing constantly. If you thought it was one way before, they're changing it right under the blink of your eye and you don't know. So stay aware. This is why we're having this conversation right now, so you guys can stay aware, so you guys can stay in the know. Let's go on. We're still talking about HIPAA and the vax. A potential violation of federal laws such as anti-discrimination or the American Disabilities Act, ADA, or genetic information. Hey, the real C the guy. Potential violation could be discrimination and discrimination, the violation of the American American Disabilities Act and the Genetic Information Non-Discrimination Act by asking an employer, have they chosen, why they have not chosen to get the vax. So if someone does ask you as an employer and now they want to further know why, let's say you say, no, I have not, and they further want to ask, inquire why, that can be a possible violation as far as your federal rights, like discrimination rights, American Disabilities Act violation, a Genetic Information Non-Discrimination Act violation. And if you live in the state of California, there's something called California Privacy Rights Act. It may be in violation of that. So again, knowing your state law. So if someone asks you, employer, organization asks you, Did you get the vax? You say no, and they further ask why not. That could possibly be a violation of your federal rights, especially if any type of disability information is going to be elicited from your no. So if you say no, and then you're asked why, and you're now having to tell that I have some form of disability or medical disability as to why I have not chosen to do that. Someone inquiring about that, and you having to give that disability information, your protected health information, that can be a violation of the American Disabilities Act. But again, I'm no lawyer. This is legalese we're talking about. So I'm just breaking it down from my perspective, understanding English, right? And understanding the science behind it. Again, you will want to speak to someone in your state. You'll want to speak to a lawyer. However, knowing the basics, we give you basics right now. So again, check state laws. Now, check state laws, they are changing, right? Some states prohibit employees in the public sector from asking employees about their vax status. So certain states, you cannot even ask someone that. I wish I had all of that information to share with you guys. I do not have that information, but I will have to get that information because you need to know that. This is information that you need to know. Now, employees' answers are recorded and protected against unauthorized use and disclosure of this information or your protected health information, or used to impact employee benefits, roles, or work experience determines whether or not an organization is in compliance with relevant law. So if the answer to your question, whether yes or no, is used to impact your employee benefits, role, or work experience, that can be a violation of your rights. Now let's continue. 2202, what up? So we're continuing the conversation about HIPAA and the vax. So can a business ask for proof of the vax? Yes. However, that is subject to state laws. Now, because of the American Disabilities Act, a business cannot flatly refuse service if a customer cannot prove vax status or if a customer refuses to disclose their vax status. The business can require the customer to wear a face mask or organize an outside delivery. If the customer refuses the compromise, then the business can then refuse service based on health and safety grounds. Okay, notice people, give me a thumbs up, or let me know y'all still here, we're not sleeping, okay? We digesting all this content, this information, okay? So can an employer refuse to tell their employer about their vax status? Yes. Someone comes up to me at my job, my employer, supervision, or management wants to know, have I received the vax? I can refuse, tell them that information. Can an employer ask for a negative test before return to work or to a university? Yes, that's not a HIPAA violation. Okay, great. Thank you, Nisi. Can employers require employees to get the vax? No individual is required to have the vax, as they have their choice of whether to or whether not to be vaccinated, right? And now it can be consequences for the refusal of the vax if using non-medical or non-religious grounds. So if you decide for you and your family or yourself that I do not want to put this into my body, I do not want to I'm going to opt out of getting the vax. You can use, as of right now, remember I told you laws are changing, you can use medical or religious grounds to state why you choose not to do so. Is it going to be an easy route? Probably not so, because they're going to make it so hard that everyone wants to choose to get this. So life will be so much easier, right? So you can say, no, don't want to get the vax because it's my choice of what I want to do with my body. You can't choose for me. That is my God-given right. Now, Employers can have policies that require employees to wear face masks during this pandemic and can refuse entry into the workplace if the mask is not worn. So if your employer says, listen, we're sticking with these face masks until the end of the year, whatever, and you say, I'm not coming to work because I'm not wearing no face mask. Okay, now the employer has a right to have their own policies as far as this goes. And if you refuse to abide by the policies, yes, there can be repercussions to your employment with that employer. So know that. Now let's continue a little bit more. So the Civil Rights Act of 1964 requires employees to provide reasonable accommodations. This is where reasonable accommodations comes in. There's always a caveat. So someone says you got to get mandated, it's required, though there's always a caveat. Remember we talked about medical or religious grounds being one of the reasons or one of the ways you can state that you want to opt out. Now, you are given reasonable accommodation under the Civil Rights Act of 1964. For employees who have strongly held religious beliefs, and the ADA, the American Disabilities Act, requires employees to provide reasonable accommodations for employees who have an underlying disability under the Civil Rights Act. Accommodations, therefore, need to be made for individuals who have refused the vax on these grounds. So you got a medical disability, any other type of medical reasoning, or religious grounds, strong religious beliefs as to why you're choosing to opt out is the reason why you can choose to opt out. And then repercussions, I won't say that there won't be any repercussions, there shouldn't be any repercussions, but you never know how the land of the law goes, or the law of the land goes. But just know that you are protected under rights of the Civil Rights Act of 1964. You're also protected under the HIPAA laws of 1996. That's a great question. What constitutes as a strong religious belief? Now, again, remember I told you things aren't crystal clear. So I don't think no one can tell anyone what is a strong religious belief to them, because it is a belief of yourself or of whatever religion you follow, whatever way of life you follow. No one can tell you that it's not a strong religious belief. However, they've stated like that probably to get people to back away from it, or second guess whether or not they can actually provide that information while they're stating for religious beliefs that they choose, they're going to opt out. So whatever your religious belief is, stick to it. You believe in it. Provide that testimony and provide the information. I don't know how someone can come back and tell you it's not a strong enough of a belief, or it's not. I don't know what that will look like. I don't even know if that's even possible. But you know, the law of the land, you absolutely don't know. But great question, Nisi. Gold star for today goes to Nisi. Shout out. Now, can anyone be terminated for refusing to get the vax? Check your state laws. It is possible. However, the past employee can take legal action against their employer for wrongful termination. So if I am working at Big Lots, I get fired because I don't want to get the vax. Excuse me. Me being a previous employee of that employer of Big Lots, I can take legal action against the employer for wrongful termination. Will it be an uphill battle? Be prepared, but know your rights. Why? The vax is not an approved vax by the Food and Drug Administration. However, it is under what we call EUA. We discussed this before. It is under the Emergency Use Authorization. The EUA requires a drug or vaccine to be accompanied with information for individuals about their right to refuse and to be told about consequences of such a refusal. So you have the right to know what requires a drug or vaccine to be accompanied with information. You have a right to know information for individuals about their right of refusal. So you have the right to know if you refuse, you are to be told of the consequences, right? The fact that we're even talking about consequences when you refuse to put something in your body is beyond me, like consequences. Okay, so know that. So people, basically, you can't be fired. So don't think that you can't be terminated, you can't be fired. Now, if you got the power, the money, and the wherewithal to take legal action to go further with that, God be with you, because they're going to make it hard for you. Now, HIPAA and the vax, we're still continuing. I'm asking these questions so that you guys will know. So, can the federal government mandate the vax for federal employees? Now, remember in the beginning, we talked about how President Joe Biden is trying to push so hard to have federal employees all vaccinated, to get the vax. Now, yes, but the federal government is subject to reasonable accommodation provisions of Title VII and the American Disabilities Act and other EEOC laws, Employment Opportunity Commission, okay? Or you can turn to, if you have any questions, the Safer Federal Workforce Task Force for additional guidance on agency operations during the vid pandemic. So, can a federal government mandate the vax for federal employees? Yes, this is what the law is saying now. Prior to, I remember when I did do research, and it was very light. It wasn't that much, that a private sector could say, yes, we can mandate it, but not public, and definitely not federal. Laws change, right? Again. So, know that you are protected under Title VII, the ADA, and EEOC laws if you are a federal employee. Now, Title VII and the ADA require an employer to provide, again, reasonable accommodations for employees who, because of a disability or sincerely held religious belief, practice, or observance, do not get the vax. Unless providing, welcome. Unless providing an accommodation will pose an undue hardship on the operation of the employer's business, the analyst for undue hardship depends on whether the accommodation is for a disability, including pregnancy-related conditions that constitute as a disability. So, if you're pregnant, pregnancy is possibly covered under Title VII. So if you say you're pregnant, I don't feel comfortable getting this vax, I'm going to opt out. You're covered as a part of the ADA Disability Act, right? Because that is considered, they're going to consider you as a disability, or they're going to cover you under Title VII. So as a pregnant person, you feeling uncomfortable, opt out, yes, you have that option. Now, HIPAA and the vax on public health. How are people sharing protected health information? What's going on with the CDC getting information? What's going on with the states getting information? You'll see metrics and data now saying that this ethnic group or this gender or women or age groups or brackets, these demographics are now at this point, these many people have been vaxxed, these many people have not received. So how are they getting these metrics, these statistics? So what's happening is that your protected health information is being shared and transmitted through these business entities, right? How is that possible that they can get this information? This is nothing new. But authorizations would not require when sharing vax status information for public health activities. So, such as activities include for purpose of preventing or controlling disease, injury, or disability, including but not limited to the reporting of disease, injury, vital events, and also for the conduct of public health surveillance. So that is what we're in right now. Public health surveillance. CDC has been surveilling what's going on during this pandemic to be able to share updated information, status, death tolls, all of this information, state to state and globally, as far as how it impacts the public health activities. Also, as well as to conduct public health surveillance, public health investigations, public health interventions, or at the direction of a public health authority to an official of a foreign government agency that's acting in collaboration with a public health authority. So, the United States can share information about health information with France or Italy, if that's going to be able to, let's say, bring this whole scope into an understanding and to be able to combat it. Welcome, 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 CJ Johnson 84. So that can happen under law. Now, what should not ever happen is that any type of link information, which is called personal identifiable information, your PII, should be swept clean of the health information. So if health information is going to be transmitted and sent to other foreign entities or to other business entities, it should not say your name. It should not have your date of birth. It should not have anything that links you to this information. So that's what should not be happening and should never happen. That would be a violation. Now, I know I gave y'all a mouthful today, and it might have been hard to stay in there with me and not have a snooze fest, but I had to tell you guys about what's going on around you and how it is relative to what's happening today in the state of a pandemic, right? Or instead of recovering from a pandemic and possibly going right into another one with this different variant. Okay, so are there any questions on the content that I went over today? And if not from today, I'll answer questions that maybe somebody has a pressing question outside of what we just covered in content. But I first would like to address if there's any questions, and let me get off of this so I can see if anyone's on YouTube, and let me know if there's any questions there. Okay, I don't see, let me go to my chat. I don't see any questions there. Does anyone have any questions on IG? There's got to be something out there that you may need clarity with, or you have a question. This is your time. Speak now, forever hold your peace when it comes to Professor Health. And I'll give you guys a recap. If you want to see the actual slides, you can have this information. You can share it with your friends and family. The presentation is on the YouTube page. If you go onto the YouTube page and you do not like, share, and subscribe, slap yourself, because I will slap you through the phone. I'll probably slap you in person, but I probably won't see you. But go ahead and go over there and like, share. I'm just joking. Go ahead, go over there, like, share, and subscribe, and watch the content and share it with your friends and your families. Digest this. This is information that you guys need to know. We're in the information highway, and a lot of things are changing around us when it comes to this pandemic. Know your rights and know how to maneuver and navigate out here, okay? So, trending news, New York City, first city to require proof of the vax for indoor dining, gyms, performances, variety of New York City workers by September. Now, New York City workers are public workers. So I'm very interested in how that's going to work with mandating a public entity to get vax requirements. Because private can. Public is like that. It's supposed to be a no, but it's kind of like that gray area now where it's like you don't even know what is what anymore. So check your state laws. France and Italy doing the same thing that New York is doing. We talked about President Joe Biden wants to make federal employees, this is a mandate to get the vax, trying to do that, but he's going to make it hard, have to give a reasonable accommodation. So now people are going to be able to get tested. How frequently you need to get tested, that hasn't been discussed as of yet or that I know of right now. DC Mayor Muriel Bowser sending out volunteers and knock on doors to see if, asking people, have they been vaxxed? This is also happening in New Jersey. If it's happening in a state where you are, let us know, put your state in here, and then we'll actually inform everyone else, or people who are on here can tell everyone else. It's coming to a state near you, okay? If it ain't already in your state, it's coming to a state near you. You're going to be baffled as I was when I looked at my door and I was like, how can I help you? Have you gotten the vax? Excuse me? Who are you? Why are you asking me this information? They don't even know. So I'm beefing with the volunteer. They just ask a question. They don't even know what they're doing. They just ask questions. So they just lined up people. You put people in harm's way. They come onto private property. My house is private property. And they asking me some shit, excuse my language, about my protected health information. I got a right to feel offended, and I got a right to guard the information. So do you. So that's what's trending in the news. Okay, well, what we like to do, we like to know where our students are today, where you at, where y'all from in here. Let me know where y'all from in here and where y'all at. I want to know that. I need some class participation. We always like to do something that gets the students and gets the class, you know, a little bit lively. Since we are not in class, we're actually via social media. I need to know where y'all at in here, where y'all from. So where y'all from in here? The DMV, Stacy for Wellness. Thank you, but that's not good enough for me. The DMV can be so many places. Where you from? Thank you. I am from Washington, D.C. That's where I'm at. That's where I'm from. Tell me where you're from in the DMV. Charlotte. Whoop, whoop. New York. Okay. So, Nicole. My line sister Nicole is in here. Love you, baby girl. Well, I'm here now. Yes. Because you ain't from there. Fort Washington. Okay, Stacy for Wellness. That's what I'm talking about. So, Nicole, we talked about New York City. And New York City, you know, you live there. Tap in and tell us what's going on there. How are the people feeling? What's the temperature like in New York City with all these new laws rolling out? Like, how are y'all feeling there? Are people like, listen, we're fighting back against these mask mandates because, excuse me, as public workers, we're not going to do this, so we have rights. So what's going on? Let us know if you can. Fill us in. Okay. Key Talk, if I'm saying that right, 124. I don't know where's 124. Maybe I'm a little slow, a little ignorant to what 124 is, but I don't know. Let me know. Pretty much enforcing policies with the vax. Yeah. So public workers, are they saying that you guys have to wear masks up there? And for indoor dining, gyms, and performances, they're like, we want proof of the vax. So do they want proof of the vax for you? They are excluding unvaccinated people from visiting public places like indoor dining. Wow, gyms. Yeah, so we talked about that. So basically, it's going to be a pair of the have and the have-nots. This is what we're talking about, classism right now. So how the rich may look down on the poor or the less than, and like, I don't want to be in areas where they are. It's about to be a class issue. We are going to now have a separation and segregation of those who have been vaxxed and those who have been unvaxxed. So public workers have to be vaxxed or tested weekly. So that's exactly what they're saying. Okay, so they give you a reasonable accommodation where it's going to be cumbersome to get tested weekly. But now I want to know, are they paying for those tests? Because I'm not coming out of my pocket and paying for a test weekly, because this is a requirement that you are now putting into place. You should at least have it set up where people can come and get tested weekly if that's now your requirement of yours, because prior to that wasn't a requirement. So I love to talk to a lawyer and see what that looks like. You do have to show proof for indoors or gyms. That's crazy. So now people trying to go work out at the gym, get their fit on, get their body right, looking good, and then you telling them, you can't come in here. The healthy person that wants to go to the gym or to be healthy can't go to the gym because they choose to not get vaxxed. They're choosing health, but you're telling them they can't go work out. Ain't that about a bitch? They are still free. That's good. That's good that the testing is free. You're at least gonna have to give that. And what type of test? Is it regular screening? Signs are starting to be posted. What type of test? I don't know exactly what type of tests they're going to be providing, or what type of testing that they're going to be requiring for different states or different entities. I have no idea what that looks like right now. I guess New York City could tell us, because these regulations are starting with them first. So I have no idea. PRC and rapid COVID test. Okay, that sounds about right. So you're gonna have to do weekly testing. Weekly testing? That's so cumbersome. But also, okay, so Coley, so is it self-administered? Because the self-administered one is smooth. I ain't for one sticking up my brain trying to find out and swab my nostrils, you know. Self-administered. Okay, great. Thank you, Coley, for giving us this information as you are in New York City and you're giving us the inside scoop. So you're saying yep, yep, or no? No, they're not self-administered? I'm feeling like I want to bring you on to this live. Let me know if you want to come live and you want to share. Let me know if you want to come on live and you want to share what's going on in New York City and kind of give everyone a glimpse of what you got going on and what you're seeing there. Let me know if you want to join in right now and I'll pull you in and you can just they didn't make it clear as of yet. Okay. Do you want to come in, Coley, and just discuss or give some updates as far as New York City? Okay, no problem. You're busy. Okay. Appreciate it though. All right. So Coley just gave us a rundown of what's going on in New York City firsthand. So you can best believe this is coming to a city or a state near you, and being prepared as best you can. You know, you never know what law is going to change and when it's going to change. So keeping up with what's going on in city council, keeping up with what's going on around you, keeping your ears to the street, you know, just being involved as much as you can to know what's going on as far as politics, because you do have the right to know what's going on and to also vote, especially at public hearings, and to go to a public hearing and state how you feel and put it on record. So do that as much as you can. I also work for the city of New York City. Yeah, so you're a public city worker, correct? I guess that would be considered a public city worker. And so by September, this is going to go into effect. So New York City, I love you guys so much, but I don't know what this experiment is going to turn into, because I can just see that there's going to be a lot of backlash, because like I said, now there's classism. Now you have the have and the so-called have-nots. And now these people are going to be able to, people have been vaxxed, who are basically saying that they don't know what they put in their body, or they basically don't care about what they put in their body. So they're like, I'd rather be able to move and live how I choose to and choose health, maybe never. So I'm choosing health, and I don't want to have to be forced into a box of whether or not I can move freely in a free world, right? But if a person is going to tell me that I cannot come into their establishment because I'm a vax, well, you know what? Fuck your establishment. I ain't got a problem cooking for myself at home. So if that means that the whole world is going to change and how I move in the world is going to change, so be it. So be it. Why? Because my body, my health is just that important. The cases are rising. The vax people are shedding the virus too. So crazy enough, right? Crazy enough, right? I do not know the actual stats, and I can go and do this research about, or even if this research even exists, these stats exist about the amount of people, because you know the amount of people that have received the vax by state or by ethnic groups or racial groups. That information is there. But now, if those people who have received the vax are now the ones in turn manifesting or getting the virus again, or if they've never had it before and actually getting it for the first time, I want to know those statistics. Because I can only imagine that when you are receiving this vax and you're running down a well-functioning and probably well-built immune system prior to receiving it, your body is now going to go into shock. And now you're producing an abundance of this spike protein, right? And your body is like, what the hell am I doing with this and what to do with it? Now, can it cause your body to manifest illness? Yes, of course, especially if you have comorbidities and all these other things, right? So I can only imagine what's happening in a body right now of someone who has already received this vax. Your immune system is slowly going to deteriorate around you because of what you put into it. And we've talked about what was in there before, but a big portion of what's in there is that spike protein. They're using a different system, mRNA, which most people don't even know what that is, but they're getting it jabbed into their systems. So Professor Health is here to help you navigate and make the best decision for you and your family. But I have to give you the content, but I gotta keep it raw. I gotta keep it funky with y'all, letting you guys know that this is not a game out here. It really isn't a game. And if you take your health as serious as I do, you want to make the best decision. And I'm just going to tell you to review the information and make a logical decision. I'm not here to tell you what decisions to make, but make the best one for you. Okay? I don't want you to, down the line, you get the vaccine, you're like, God knows, I don't know what's happened to my body right now. Because you don't know the effects of what can take place or what can happen in the acute or the long term, short term or long term, because this is an experiment. And this is what happens when you experiment. Even when you experiment with drugs, you don't know the outcome. You might have heard, but it can hit you different. You're really in a drug experiment right now. So be wary. Be very aware of what you're putting into your body, even outside of this vax, okay, on your regular. Because we want you to have what healthy and robust immune systems. But I've gone off on a tangent. There aren't any other questions. I will be tapping out of here soon. Let's see, they are following Europe. Yes, because we talked about France and Italy. New York is actually doing the same thing that France and Italy is doing. And Mayor Bill de Blasio. Is that, now that I think of that name, is that name Italian? Is that an Italian name? I think that's an Italian name, right? Huh. Okay, the cases are rising. And what else did you say? We have the Delta variant, which appears to be super contagious. Appears to be super contagious. I don't know. Yeah, I don't know how I'm feeling about the information of that propaganda that's being spread to the masses. That this variant is super contagious. Right. A whole virus that has been man-made, and now it's metamorphing. And now we're like, oh, this one is so much far worse than the one before. Well, hey, if you never invented this shit, we wouldn't even have this as a problem. But however, that's for another discussion. And I gotta watch my tone. I gotta watch my tongue when I'm out here talking about this stuff on their platforms, because I don't want to get flagged. Oh my God, the commercials are crazy. I can imagine what the commercials are like. Fortunate for myself and my brain power, I just don't have that kind of brain power to digest the illogical. So I cannot watch stuff like that. But for some things I have to watch to be able to come back and tell you guys things. But like, I just can't get with the nonsense. What happened to beta and gamma? What happened to beta and gamma? Hilarious. And Coley, I hate the fact that it's called the Delta variant. Okay, like, stop it. I guess that's me being a Delta. It's like, oh, why you got called the Delta variant? I don't know how the etymology came up. I really don't, but I really hate the fact that it's called the Delta variant. All right, so been on here about for an hour with you guys. Thank you so much. Gold stars go out to Nisi, my girl in Charlotte. Gold star goes out to Coley, my line sister in New York City. And gold star goes out to Stacy, who was in the DMV, to let us know she's over in Fort Washington. Thank you so much for your participation. Coley jumping in here and letting us know what's up in New York City. And everyone else that participated or even came through for a second, you stopped past, thank you. We appreciate it. And over here, we love you. Professor Health, the mad scientist, your friendly neighborhood healer, but not your average dope dealer. We love you. We want to see you healthy and happy. And let's keep it like that. Any questions? Please feel free to DM me, or I like to receive emails. I love emails. You can DM me. Asking me inquiries. I do respond. I don't always charge. So if you feeling froggy, jump in my DM, ask me a question. Ask me questions under my posts. Drop some love, like, share, and subscribe on YouTube. You can also drop questions over there in the comments section. I do sometimes reply as much as I can. I love you guys. Have a great evening. Oh, before I go, hold on. Time out, pause. Before I go, I'd be remiss if I couldn't talk about one of the biggest events that just went down yesterday. Anyone know me know I'm a hip hop head. I am a music fanatic. We can't sneak out of here without talking about the Locks versus Dipset on the versus battle. Now, I've been talking to my friends, I'm talking to my boyfriend, and we all knew it's over here living in the Northeast region, especially if you're from New York, you're from New Jersey, you're from anywhere down to DC, all of that, even probably down to Virginia, Atlanta, all the way down to the East Coast, right? But when you're in the Northeast, you've been listening to that music since you was a child like myself. So I knew going in, I'm a Locks fan. First of all, I'm a Jada Kiss fan. Top 5 dead or alive. That was never a lie. So who won last night? Coley is saying the Locks. Hello. Anybody have any discrepancies with the Locks being the winner by a landslide over Dipset? Ow. I don't know what they was doing yesterday. They was looking so like unorganized, discombobulated. The energy wasn't there. They weren't clicking. They weren't firing all cylinders. They was looking a little dustbuster. They was looking dusty. Like the Locks, D-Block, finesse, slaughterhouse. They slaughtered them. So we no longer talk about Hip and the Vax, but I just had to let y'all know we cannot leave without talking about that versus battle last night. That was historical, okay? Historical. If not one of the best yet. Anything Jada is always touching, that shit is like gold, okay? But anyways, all right, now I'm out. Peace, love, and health. Holla! Listen to me now. Yes, we want to share this to IG. Okay, we're over here at where are we at? All right, peace, love, and health.